we are back now with the GMA Health Alert. With flu cases climbing, millions across the country are testing positive as many prepare to spend the holidays with friends and family. Dr. Leah Kroll joins us now to talk more about this. Dr. Kroll, thanks for being with us. Tell us about the latest numbers and who's getting hit the hardest.
So here's what I've got, you guys. The CDC is estimating 4.6 million cases of flu so far this season, 49,000 hospitalizations, 1,900 deaths, including 3 pediatric deaths. The rates of these things are rising very, very rapidly. The spread is really picking up. We're expecting to see those numbers continue to climb. New York is getting hit very hard, very high levels of respiratory virus activity around here. Some other states with moderate levels of activity, Colorado, Connecticut, New Jersey, and others. Now, a lot of this spread is being driven by a new variant of the flu that's actually a little different than what the vaccine was designed against. Good to know, though, that doesn't mean the vaccine is ineffective. It still accomplishes its mission. It reduces your risk for serious illness and complications from the flu. So absolutely a good idea to get it if you haven't. It's not too late, especially as we head into the holiday season.
All right, so let's talk about that. If you do get the flu, or if you come in contact with someone who tests positive, what treatments are available for you?
So luckily, we've got 4 FDA-approved medications to treat the flu. Tamiflu is the most popular one. Xofluza is another popular one because it's one dose and you're done. Essentially, the pill that you get prescribed is really going to depend on your doctor, your case as an individual, what's available in your area, what your insurance is willing to cover. What's important to know with all of these is that time matters. You want to start taking them within 48 hours of symptom onset. They're most important for people who are at higher risk for severe illness, so that's young kids, older people, pregnant people, people with underlying medical conditions like diabetes, asthma, heart disease, things like that. Now, also very cool here, you can use them as prophylaxis, meaning if you are exposed to the flu, you have someone in the house with the flu, someone comes to Christmas and they're coughing all over you, you can talk to your doctor about using these medications to prevent getting the infection yourself.
If you're feeling sick, best advice.
I hate giving this advice this time of year, Gio, but the truth is the best thing you can do if you're feeling sick is to stay home. You want to protect the vulnerable ones in your family, the young ones, the older adults, people with any high-risk conditions. Now, in terms of preventing the flu, if you're hosting, I really want people to focus on disinfecting high-traffic surfaces as much as they can, encouraging people to stay on top of hand hygiene as much as they can. If you do get sick, vast majority of people are going to be able to stay home, get rest, lots of fluids, over-the-counter medications. If symptoms are mild but uncomfortable, you can go to an urgent care for more treatment. But if there's any inkling of a more serious symptom like trouble breathing, chest pain, a persistent fever that won't go away, dehydration, those would be reasons to go to the emergency room and get checked out and really have a low threshold if you have a young kid or someone who's vulnerable in the family.
Yeah, important reminders. Thank you so much, Dr. Leah Kroll. We appreciate you. Still coming up here on GMA3, Bowen Yang.